Thank you so much for your remarks, Vice-Chancellor. It is now my pleasure to introduce our first speaker, Dr. Simone Brott, who is a senior lecturer from the Faculty of Engineering.
I'm an architect interested in how non-fungible tokens will transform architecture. But more than this, I want to be the person who brings architecture into the crypto space. If Hans Christian Andersen were alive today, he'd say the emperor has no clothes, but he has an NFT, a digital outfit. In 2020, RTFKT Studios launched a sneaker brand whose NFT shoes exist only in a digital world. In 7 minutes, they had sold $3 million because the imaginary garment is now more valuable than a wearable. In the last 3 months, NFTs have exploded in the cryptocurrency world. I'm currently working on a new platform for architects to trade NFTs via the blockchain following a talk I gave at the Urban Assemblage Conference in London. An NFT is a unit of data that certifies the authenticity of a digital asset, such as a piece of music or art to which the token is linked and represents. NFTs are stored on a blockchain and then auctioned on NFT marketplaces like OpenSea and SuperRare. Artworks are called non-fungible, meaning unique and non-interchangeable, as opposed to a fungible or interchangeable asset like cryptocurrency. So 5 bitcoins are fungible as they are substitutable with any other 5, but no house is equivalent to another. NFT sales are executed with smart contracts, algorithms built into the blockchain which trigger actions based on predefined parameters, e.g., they can automate royalty split payments at the end of an auction. I believe NFTs will liquefy architecture through a chemical reaction of blockchain, cryptocurrency, and architectural imagery bordering on science fiction. It will reconstruct both architecture and the finance world. Imagine Zaha Hadid Architect sells an image NFT like this to a developer who sells it on to other developers for a profit without building anything. The firm receives royalties each time the NFT is traded. Instead of financializing a small number of built projects over a lifetime, it financializes thousands of designs adapted to any site. The NFT is later securitized by being fractionalized into 1,000 NFT units. Securitization means bundling the payment streams of a set of mortgages into a series of units or bonds sold to investors. Eventually, the rights to sell an architectural image are NFT'd and securitized, like the 97 Bowie bond security, which used current and future revenue from albums recorded by David Bowie as collateral. This could be scaled up. Now imagine Patrick Schumacher from the same firm designs a future city whose master plan is securitized into NFT units and sold to investors. The rights to duplicate the city 10 times in different locations in the world are NFT'd. Eventually, when built in Asia or the Middle East, NFT units in that city's design's revenue streams are sold. Goldman Sachs creates a new financial instrument by bundling multiple master plans by iconic architects, securitized into thousands of NFTs divided into tranches, assets grouped by different risk factors and yields. Firms like MVRDV stop building anything at all and rather NFT their renderings of megacities for Asian and Middle Eastern clients. I've always been obsessed with architectural images because for me, the images architects create are the purest document of their visions. But they're also an exact mirror of our society. They tell us what the mass spectator desires and fears. And that was always interesting to me, that images had this unconscious dimension. I started at Yale in the early 2000s researching filmic images of architecture and cities, and that developed into my work on the digital image, most recently my book Digital Monuments, which begins with the idea that you go to visit an iconic building by a name architect and have the surreal experience you're looking at a digital rendering on the ground, not a real building. And I argue that these digital images used to generate designs and that exist 10 years prior to any real building being constructed were distorting capitalism before anyone had said NFT. Paradoxically, the NFT space is lined with bad art and a subset I call pseudo-architecture, like this digital house by artist Krista Kim, with all respect, or the Eiffel Tower NFT created for the metaverse of virtual worlds like Second Life, or digital renders by architects like Chris Precht. None of these are architecture. Serious architecture, as we understand it, meaning radical formal intervention into global cities, is immune to the NFT space because, unlike art, architectural images have always been seen as bound to a future building as advertising or visionary devices. And as architects view built design as their core business, they don't see they are giving away principal assets, IP intrinsic to their branding. This devalues the entire apparatus of electronic assets in architecture and divests architecture of its autonomy. There is no framework for drawing investment to architectural images. It's hard to imagine Frank Gehry listing an NFT of one of his masterpieces alongside an animated cat. But the truth is, in future, original architecture will be designed purely for NFT sale. NFTs are the dream of the iconic architecture industry, which, after all, has always favoured image over reality.
Thank you for your presentation, Simone. It seems that NFTs may be a very useful tool for artists and architects alike. I'm now delighted to introduce our second speaker of the day, Dr. Joanne Gray, who is a lecturer from the Creative Industries, Education and Social Justice faculty.
In our digitally networked society, immense social, economic, and political power is concentrated around a small group of powerful private companies. I'm talking about the dominant digital platforms Google, Apple, Facebook, and Amazon. These companies create, own, and govern vast global socio-technical systems in which so much of our day-to-day lives play out. They've grown so much over the past decade, they seem to now intersect with almost everything we do. This reach gives these companies a lot of influence in contemporary society. In my research, I investigate the various manifestations of platform power because, in my view, unmitigated and highly concentrated platform power is a serious threat to the health of democratic social systems. Different controversies have provided glimpses into the problem of concentrated platform power. For example, in 2018, the Cambridge Analytica scandal revealed the extent to which social media data can be leveraged to influence the outcome of democratic elections. Over the past 2 years, we've seen how the spread of conspiracy theories and misinformation across platforms has impacted how large groups of people think about public health matters such as mask wearing and vaccinations during a global pandemic. Even more recently, whistleblower testimony in the US revealed how Instagram is having a seriously harmful effect on the mental health of teenagers everywhere. In response to these and other issues, the dominant platforms have presented new and innovative ways to self-regulate. They've basically said, don't worry, you governments don't need to regulate us, we'll take care of it, we've got this. And then they've introduced everything from elaborate automated content moderation systems, such as Content ID on YouTube, to Facebook's quasi-judicial body, the Oversight Board. Really, the dominant platforms have been twisting themselves inside and out with self-regulation in order to avoid public regulation by democratically elected governments. But self-regulation consolidates platform power. Platforms are free to devise rules and governance models that prioritize their own interests. Self-regulation also makes more difficult the task of protecting democratic principles such as fairness, public accountability, and legitimate democratic control over social institutions. The more I've researched platform power, the more I've come to believe that ensuring that digital platforms are governed and operate legitimately and according to the interests of a democratic society is an urgent policy and scholarly issue. This is why I've begun to develop a research agenda that aims to enable Australia to become a global leader in effective public regulation of the dominant digital platforms. And I believe there are 3 fundamental steps that need to be taken to achieve this goal. First, to be effective, regulation aimed at the dominant digital platforms requires increased international collaboration. While there is clearly a growing consensus around the world that public regulation of digital platforms is needed, how to do so effectively remains unclear. In different jurisdictions, policymakers have pursued a variety of interesting and valid initiatives, but they've done so with very little emphasis on global harmonisation. And this is a serious problem for the effectiveness of regulations aimed at impacting the structure and practices of thoroughly transnational organisations. Second, we need to improve understanding of what platforms are for the purpose of regulation. Platforms are functionally very broad, operating across industries and social domains, and because of this complexity, we often talk about them in vague or incomplete terms. In my work, I've sought to address this gap by adopting a systems ontology, to reconceptualize the dominant digital platforms as complex systems and to better understand the types of regulation likely to have the broadest impact within a platform ecosystem. Finally, for Australia to take the lead on effective public regulation of the dominant platforms, we need to have a clear vision of what we want for our digital society. This requires grappling with a range of potentially competing economic, social, and political values, and deciding what we wish to prioritise and how. The ultimate goal of my research is to support public regulation of the digital platforms that is proactive, with a potential for systemic impact, and which ensures that these platforms at the centre of our lives are imbued with the values central to a flourishing democratic society.
Thank you, Joanne. The complexity of effective regulation is a topic that is not lost on me, and I very much enjoyed your presentation. Now I am very pleased to introduce Dr. Char-lee Moyle, who is a senior lecturer from my own faculty, the Faculty of Business and Law.
Change, the only thing that is truly certain in this world. I grew up in a small country town called Char-lee, located in southwest Queensland. I experienced firsthand the heartbreak of a slowly declining community, watching the shops close, the locals leave, having less to do, and the permeating feeling of despair. Fast forward to 2000, and I was finishing high school, having the stark realisation that there were no well-paying local jobs, and that I did not have the money nor the skills to start a business in town. So I packed my bags and went off to university in the big smoke. Now, 21 years later, after having worked in every level of government in economic development, completing a PhD in regional transformation, and going on to an academic career focused on transforming regions, industries, and businesses, I can tell you that the secret to successful transformation in any context is to embrace and manage change. The choice is to either grow or die. Today, the world's most valuable resource is no longer oil, but data. As our economy becomes increasingly digital and data-driven, we will continue to see the growing adoption of technologies like artificial intelligence and robotics in the workplace to enhance automation and improve decision-making. We are seeing a rise in the importance of data scientists and the entrepreneur, combined with a change in the physical distribution of the workforce. These changes in the way we do business are disrupting how we grow industries and transform regions in which we live. My research focuses on strategies to manage and accelerate change to ensure growth. I am a leader in understanding the drivers of transformation. Regional drivers of transformation include inter- and intra-regional learning, data and research capabilities, and business agility and adaptability, which has incredible implications for another phenomenon that I am fascinated with, data-driven decision-making. I was the lead QUT researcher on a project that examined 9 emerging tech sectors for Queensland. Our research identified the economic opportunity of these sectors, finding that most of the new jobs will centre in green metal manufacturing, AI-enabled healthcare, and agricultural sensors and automation. We calculated the number of jobs in these emerging sectors through a novel text mining approach to industry sector identification in microdata. In fact, I invented a new way to measure the number of jobs in emerging tech sectors, which helps the government to make better decisions. I have investigated entrepreneurial strategies that lead to tourism growth using bibliometric methods to explore 500 Australian tourism strategic planning documents. Integrating this data with measures of regional economic outcomes, such as output and jobs, I found that tourism growth was particularly accelerated in regions where there was a tourism strategy, targeted strategies to support tourism entrepreneurs, and a focus on human capital development and tourism incubation programs. It is not by coincidence that the 2 most effective strategies for accelerating tourism growth relate to upskilling people and businesses in the tourism sector to be more agile, adaptive, and innovative. My research also considers the role of flagship projects and programs in transforming regions. Flagship projects that I have studied include the Queen's Wharf development, the Advanced Queensland program, and the Commonwealth and Olympic Games. My research works to predict the likely benefits and costs of a policy, monitor the progress towards the greatest net benefits, and then evaluate how the programs or policies achieved their results or could have worked better. I have developed and applied new approaches for evaluating the Advanced Queensland program and the Queen's Wharf development. I am now working to establish a multi-decadal program to develop the world's most advanced, data-driven economic monitoring and evaluation system that can be used to monitor, evaluate, and maximise the legacy of the Brisbane 2032 Olympic Games. Given that every Olympics since the 1960s has run over budget by about 172%, and the event continues to get larger, more disruptive, and less plannable, it is important that we fully understand the role the Olympics will play in the transformation of Brisbane. Which brings me back to Char-lee. Today, I work with regional communities to guide the development and to create decision-making tools that assist regions to identify the right strategies to help them accelerate growth, monitor their progress, and then evaluate the effectiveness of their strategies. I have worked with the local Char-lee Council to revitalise the Char-lee Cosmos Centre and develop the Char-lee Planetarium. I have also involved them in an ARC Industrial Transformation Centre in autonomous vehicles for regional and remote areas to help automate the struggling agricultural sector. Through my guidance, Char-lee has taken their future into their own hands and chosen to grow.
Thank you, Char-lee. As someone who also grew up in a small town, I appreciate the research you are doing, and I know that it is needed in the regions. Now I take great pleasure in introducing Associate Professor Amina Tariq from the Faculty of Health.
Healthcare touches all our lives. Since we are born, we interact with health systems. And health system is broad. It can comprise of our hospitals, our GP clinics, our pharmacies, even the Google doctor we all like searching all the time. But healthcare is really complex. There are so many processes and so many things that are involved and affect healthcare service delivery. Like technology is touching all our lives in all aspects, with banking, with retail, technology is now a big part of healthcare delivery as well. We are trying to find ways in which we can use technology to improve efficiencies in healthcare while maximizing patient safety benefits. We now have opportunities to use broad spectrum of technologies, from electronic patient records to mobile apps. We are hearing about so many good information websites that we have. We can use all of them in combination to improve healthcare service delivery. But we still live in times where we need more evidence. As a digital health researcher, I am passionate about making a difference in healthcare with technology. My main aim is to highlight the evidence if technology is really making a difference, and if not, why? Which are the gaps that we need to address? And in this brief presentation, while I can give you many examples, I have chosen my top 3 examples where my research has really made a difference. These include use of electronic medical records in hospitals, mobile apps, which everybody loves, and how consumer-facing applications like telehealth and websites are being used. So let's look at first the hospital-based systems. When I started looking at hospital-based systems, we are now hearing that electronic medical records are making a big difference in hospitals. But there were hardly any studies done to really evaluate or quantify those benefits. So we looked at Australia's first private digital hospital, which is in Hervey Bay, which was the Greenfield Hospital. And we looked at if the implementation of electronic medication management system, closed loop systems, from prescribing to really getting the medication, is really making a difference. We found out that yes, it is, because the digital hospital was delivering 77% of time-critical medication faster to the patient as compared to 38% for those in paper-based hospitals. So this is a promising benefit. But when we looked at other systems that are coming from these medical records, like electronic whiteboards, we found out that they still have a very long way to go when it comes to improving team communication, which is big in healthcare. We really want our doctors, nurses, all to communicate better. And these applications are still not user-centered or designed with healthcare processes as they happen in real in mind to actually make a difference. Now coming to mobile apps, we all love them, we all use them for different purposes, especially, our banking, our shopping, everything is happening through apps these days. So we wanted to look at, in my research, how mobile health applications are optimizing healthcare, not only in developing world, but also in the developed world. So both ideas are there because smartphones are really everywhere. So when we looked at developing countries, I co-edited a book with my colleagues, and we found out that till mobile applications are really contextualized to the local culture and really are considering local norms, local language, they may not be that beneficial. We also looked at how mobile applications can actually help in managing chronic conditions. For example, one of the studies that I conducted was around looking at apps that exist for gout management that help patients to manage their condition, which is a very common chronic condition, unfortunately, especially in Australia. When we looked at App Store, we found out many apps, but we realized only one of the many was actually compliant with the guidelines that were delivered by Australian Therapeutics. So there is still a long way to go to make these apps compatible with the guidelines. Most of them rely on very, primitive functions and are not authentic or evaluated with health guidelines in mind. So again, when it comes to mobile health apps, I hope I can deliver the message that the evidence is pretty much mixed. Now coming to our favorite things like calling people and asking for health advice, or even talking about consumer-based healthcare websites. Let's first talk about telehealth, which is again big, and in COVID times we are realizing more and more importance of telehealth applications. We evaluated how Australia's national healthcare helpline, Health Direct Australia, is performing. And we found out that out of the many calls, 1,442 calls they received in 1 year, they were actually trying to recommend people not to visit emergency department, and actually they recommended self-care. So when people called, they talked to a GP, and GPs recommended self-care. We found out that this has the potential to, over time, reduce emergency department care visits, which is a big deal. Likewise, we also found that consumer-driven websites, although they provide so much information, the top 4 websites used by consumers to access medication information in Australia actually don't provide a unified message. Not one website is source of truth. They provide different pieces of information, like one may be better at side effects, one may be better at identifying contraindications or how to take medication. So people really have to do the job of unifying that information. So we still have a long way to go in terms of delivering our message. So in short, the message that I want to leave you with today is that Technology is going to be there and major part of our healthcare services. But we need to make sure that we are critically looking at the evidence on its efficacy and try to maximize the benefits it provides while minimizing any risks associated with its introduction.
Thank you so much for your presentation, Amina. Our final speaker for today is Dr. Selene Turkai, who is a lecturer from the Faculty of Science.
What does remote work mean to you? Maybe you work with individuals distributed around the globe, collect data from remote locations, or you had to work from home in the last year and a half. What we know for sure is that COVID-19 has changed how we think about distances, remote work, and potentially the future of workplace. While there are advantages to remote work, such as increased sense of agency through flexible hours, there are also tremendous drawbacks. We feel isolated, may experience Zoom fatigue, and increased distractions, may feel less creative. We don't usually get those serendipitous sparks of brilliant ideas while chatting with colleagues over a cup of coffee or during one of those water cooler chats. Drawing on my background in learning science and instructional technology, my research explores the role of extended reality as a critical novel technology on transforming how teams work together. I apply self-determination theory to model the relationships of basic psychological needs, positive experiences, and well-being. I am a firm believer that, in my research, when possible, I need to experience the technologies and their affordances to have a better understanding of their capabilities to solve problems. Over the past several months, my team has experimented with holding our bi-weekly team meetings in a different immersive environment. The purpose was to understand what value they could add over and beyond our traditional workflows. In these environments, we customized our avatars, gave presentations, and held brainstorming sessions using the available tools. Despite the numerous usability issues, to my surprise, our team seemed to feel more active compared to video conferences, could use communication cues such as gestures, and felt together as if in a physical place, a phenomenon we call social presence. We also created permanent team rooms, shared documents, and could use 360 for the realistic images to customize the environments. Being able to create such custom environments to enable multiple visits is relevant to many disciplines, especially for those who rely on fieldwork. Field experiences are highly valued in scientific research and essential for discovery, yet they are becoming less common due to expense, challenges with locations, and disturbance to the environment under study. Virtual fieldwork using immersive technologies such as virtual and augmented reality presents a potential alternative to in-person excursions and video conferencing for collaborative interrogation and sense-making of science data. In my recent ARC discovery project, I work with geologists and planetary scientists who not only may work with distributed teams around the globe, but also work with data from places as remote as Mars. In these disciplines, the context of where the data is extracted is crucial. Looking at isolated images can lead to erroneous conclusions. A good example for the importance of context comes from recent geological research. A remote locale in Greenland where geologists are contesting the biogenicity of Earth's oldest evidence of life. In 2019, a multidisciplinary team of geologists and geochemists traveled to the locality to investigate the arguments in the context at the outcrop. At the conclusion of the 2-day fieldwork, the broad consensus of the peer review team was that the biogenicity argument, based principally on the field context, was unproven. This has important implications for science, highlighting the significance of context and having multiple experts examining the evidence. My project envisions virtual fieldworks to provide new ways to interact with complex data that is presented, shared, discussed, and potentially analyzed in situ. These immersive environments can help create a ground truth for science communities. Using human-centered approaches, including interviews and participatory design workshops, we will be working with scientists to design and develop tools for immersive sense-making and discovery. We will also conduct empirical tests to examine their value in both laboratory settings and in the wild. In a relevant project, we are investigating how we can work better with our robotic teammates. Associate Professor Ross Brown and I are working with an innovative Brisbane-based company, Raytracer, to imagine novel command and control interfaces for space domain. Using digital twins of robots in immersive environments, these interfaces will enable astronauts and remote experts to command and control multiple robotic systems on the lunar and Martian surface for the purposes of research and exploration. We will be conducting empirical research on the usability and effectiveness of these interfaces in lab settings. I look forward to a future where remoteness will not be a barrier for effective teamwork.